What is involved in doing cosmetic dentistry?
The process of cosmetic dentistry can be relatively simple. I mean, if everything in your bite is good and you just need some teeth brightened or something like that, then it's a fairly simple process. If their bite is good, but you have chipped or broken teeth, then maybe you need veneers, etc. And then it can be quite complicated if if we're trying to get an overall benefit that not only affects your teeth, but affects your facial profile. And if we need to do that, then it's obviously a much more complex process. We have to take impressions, we actually do modeling to determine what the ideal result will be. We might try those in your mouth and take a lot of photographs and analyze what the changes to some of to your facial profile, etc. would be. And then we go through an entire process of moving from the diagnosis to the final treatment. So cosmetic dentistry can be as simple as having whitening done, if that's all you need. You can also possibly need some veneers or some crowns where there are chipped or broken teeth, or you could need a full bite reconstruction which affects your facial proportions and profile in order to get the best cosmetic result.
How do I know what is possible regarding cosmetic dentistry for me?
So prior to doing anything involving cosmetic dentistry, we like to analyze your bite completely. So therefore we give you all your options, and that way you know what's possible. Patients often think they just want whiter teeth, but once they realize how much of an effect it can have on their facial profile, they're very interested in finding out how that can be done.